Good morning, everyone, and welcome to the Insurance and Pharmaceuticals Subcommittee of the House Government Operations Committee. We welcome the committee and the members of folks who were interested in the bill that we are discussing today. We have an agenda with only one bill on it. I hope that it will be an efficient work group on this bill. And I would ask that I will give anyone who is here who wants to comment an opportunity to do so. I simply ask that you be as brief as possible and to make your point and allow us to follow up with questions. So, and the first folks who will get a crack at questions are delegates who are members of the subcommittee. And then other participants may ask questions as well. So with that, today we are talking about House Bill 279, which is Prescription Drug Affordability Board, upper payment limits. And Lisa, would you tell us what the bill does, please?
Sure. House Bill 279 is an emergency bill. It instates provisions of law regarding the authority of the Prescription Drug Affordability Board to set upper payment limits and related requirements, including an appeals process. By December 1st, 2026, the board is required in consultation with its stakeholder council to report to specified committees of the General Assembly on the legality, obstacles, and benefits of setting upper payment limits on all purchases and payer reimbursements of prescription drug products in the state, and also to make recommendations regarding whether the General Assembly should pass legislation to expand the authority of the board to set upper payment limits to all purchases and payer reimbursements of prescription drug products in the state.
Okay, thank you. And so I will remind folks that this bill is, as Lisa just said, it's really a reestablishment. And the one question that I had from the folks in that complicated pricing chain was, are we accelerating or changing the work of the Prescription Drug Affordability Board in any way from how it was established in 2019? And the answer is no. This bill is essentially a redraft of the bill from 2019, but only because it sunsetted on December 31st, 2022. So we need this bill to put the board back in a position where it can be addressing the issues and the work of setting upper payment limits. So with that, I'm going to turn it over to Andrew York to just give a little more information about what the board does and why this bill is necessary.
Great. Thank you, Madam Chair. Andrew York, Executive Director of the Maryland Prescription Drug Affordability Board. As folks may be familiar with us, we were created in 2019, and we are charged with making prescription drugs more affordable for Marylanders. We're looking at a number of different policies that could implement that work. One of the things that's specifically referenced in our legislation is upper payment limits. We also can do something called cost reviews, which is a deep dive on specific drugs that may be causing affordability challenges. Delegate, should I take questions now, Madam Chair?
Yes. So I will take questions for Mr. York. Delegate Kipke.
Thank you, Madam Chair. I didn't mean to interrupt his statements, but I was, as you might recall, I voted against this bill previously in its in its original format, and back then the Department of Health, I do believe, was silent on the matter. But Governor Westmore's acting Secretary on Health has submitted a letter of opposition to this bill, and that tickles me in so many ways. So I just didn't know if anybody present, I'm sure Dr. DeMarco has a lot to say about it, but maybe Mr. York or can you respond to the letter of its vehement opposition, really? So I mean, just if you could provide some info on that. Thank you.
Yeah.
Thank you. Mr. York, hold on just a second. What I would like is Trisha Roddy from Medicaid is here, or Megan Peters is here. So if they could explain their opposition, and then we'll go back to Mr. York to respond. Is that okay with you, Delegate? Okay. So Ms. Roddy, would you like to
Yeah.
help us out here?
So it was, our letter is citing two issues, just that in Medicaid, we already have a federal upper payment limit. And of course, we're just conscious of anything that might come between our MCOs negotiating lower pharmaceutical costs. But we have been working with Andy, and he understands these two issues that pertain to Medicaid. He's coordinated calls with New York and other states that are doing this. And he assures us that when setting these upper payment limits, he will take those considerations into whatever policy is established. So given that, we don't want to stop the legislation. We just want to make sure that we're thoughtful in establishing these policies and understand how Medicaid is a bit different than the commercial side in these discussions, and want to make sure that nothing is done to harm our negotiation with pharmaceutical manufacturers.
Thank you, Ms. Roddy. Mr. York, would you like to say any more on that?
No, I would just kind of echo the point that Medicaid is fundamentally different from the commercial market. And I also took their letter to say, comply with all federal laws and regulations, which we absolutely agree with. And we want to make sure that we certainly don't interfere with any existing programs. I think it specifically references I don't think it specifically, I think it alludes to the federal upper limit, which is a Medicaid term of art that I think is specific to generic drugs. So we will certainly be conscientious of that. But there's also a number of other federal issues and programs that we'll certainly want to be thoughtful about. So we want to make sure we understand how any of our work could roll into the average manufacturer price and average sales price, and any potential implications. So I think it's all to say that we completely agree that we need to be compliant with federal laws and regulations, and we don't want to interfere with anything or have any unintended consequences. But I think that's the reason you have an organization like this, is to work through those issues.
Thank you, Ms. York. And I'll add that the bill specifically says that the role of the board is to develop the process by which you create an upper payment limit, and that process will be completely evaluated and either changed or accepted by the Legislative Policy Committee. So there's another step in there to safeguard against any unintended consequences related to setting upper payment limits. So I think we have the safeguards there. Delegate Shalega.
Thank you, Madam Chair. Can you remind us of how the Prescription Drug Affordability Board is funded and what your budget is? And is that a transparent thing that you can give us a copy of?
Mr. York, you want to address that? I could,
yes.
But you do it better.
Yeah, thank you for the question. So we had our founding legislation in 2019, and then we had our funding legislation in 2020. And we're funded through a fee assessment on manufacturers, wholesalers, carriers, and pharmacy benefit managers. Our annual budget is about $1 million, give or take, and we are part of the budget process. So we'll be in our budget hearings there. It's a public budget. So right now our budget includes also a repayment to the Maryland Department of Health. They kind of were our sponsors for the first few years of our work. So our operating budget is about $1 million. And we were very excited to hopefully be one of the few agencies that saves the state more money than we use. And our board chair also takes a lot of pride in us running as a very lean organization. So.
Can you give us a copy of the budget, or is it in one of the budget docs? We can take a look at it.
Yep, I'll send you the reference. It's in the budget, the 24 budget.
Okay, and so you've been in existence for how many years?
Since 2019, we were created. We were originally housed under the Maryland Department of Health in the Maryland Healthcare Commission. So they were kind of our sponsors and did a great job helping us stand up the agency. As of FY23 this year, we have been an independent agency. So we have our own agency code and our own budget. And so this is the first year that happened. That started on July 1st. But prior to that, we were housed within MDH.
Okay, so if I do the math right, you all collected about $3 or $4 million since your existence.
So the legislation was vetoed in 2020. So then it was passed and overridden in 2021. So our first fee assessment was FY22 fee assessments. We're in the process of also capturing FY23. Our fee assessments are running basically the first 2 years, and this is kind of getting in the weeds because of the way things overlap. Our first 2 fee assessment years feed into our first independent fiscal year. So we've collected about $800,000. So we have about 1,500 entities that we send the fee assessment to. There's kind of just a growing pains and learning process associated with that process. So we capture probably about 850 to 900 each year. So we'll potentially adjust those revenue. We'll make sure that the revenue meets our budgets moving forward.
All right, thank you. I look forward to looking for that budget if you can get that to us. Thank you, Madam Chair.
Thank you, Delegate. Any other questions or comments about the bill? Mr. Celentano.
Thank you, Madam Chair. The League of Life and Health Insurers enthusiastically supports this legislation and think it is a step in the right direction to try to get a control on some of the outrageous drug prices that we're all seeing and driving a lot of your and your constituents' emails. I will say that the funding of the assessment is a different discussion to this bill and was a different bill that passed a couple of years ago. And we would like to continue that conversation in the future. I can say from personal experience, I have gotten a lot of angry emails from companies and life insurance companies in particular that sell no health product, that are not involved in anything drug chain related, that are getting the assessment. And even when they have tried to apply for an exemption, they have been denied. So I would like to continue that discussion, not necessarily in today's subcommittee session, but in the future, it would be appropriate to make sure that we are not capturing companies that have nothing to do with this discussion. Thank you.
Thank you, Mr. Celentano. I appreciate that, and I appreciate the fact that you're willing to wait until a later time, not this session, to deal with that issue. Delegate Kaiser.
Thank you, Madam Chair. I'm not sure if I missed it earlier in the discussion. As this is coming forward and as this upper payment limit is taking shape, is this working in other states to reduce drug costs?
So we are the very first state that put it in place, and there are other states that are in the process of putting it in place, Colorado being the one that is farthest ahead in the process. I know that Massachusetts has reached out to us to help them develop the board. So there's no data on what the impact is at this point. I just want to be clear for folks who are new to the committee and to HGO, that an upper payment limit is what the state will pay. We are prohibited by law of setting anyone's prices. So just so folks know, this is what we would be saying to the entities that are part of that drug pricing chain that we talked about 2 weeks ago. This is how much the state of Maryland will pay. So just be clear, that's what that upper payment level is. And we hope to find out when we can get it set up, how it works and what the impact could be. Delegate Morgan.
Thank you, Madam Chair. I apologize. I had a bunch of local realtors walking in my office. I missed the first 10 minutes of this meeting. So on the upper payment limit, how is this any different than the normal, like what we talked about when we set up the Drug Affordability Board? I guess my question is, what would happen if a company didn't agree to the upper payment limit?
So first of all, it's exactly the same as when we set up the board. The only reason it's here is that was part of the sunset. So we had to literally reinstate it. So no difference at all. That's number one. Number two, once we set an upper payment limit, a company will have a choice. You know, they may or may not sell the drug in Maryland at that price. My belief is that Maryland's a populous enough state with a big enough drug market that most manufacturers and PBMs are going to want to participate in Maryland. But that is something that will have to be tested out. And the law does very clearly say, once implemented, if there's any indication of a shortage of a drug, then we'll, step back and reevaluate. So there's that guardrail there as well. Does that answer your question, Delegate?
I appreciate it. Thank you.
Thank you. Delegate Kaiser?
Thank you again, Madam Chair. And sorry, I should have asked this earlier. When I saw the fiscal note, it made reference to the fact that we're essentially we're reestablishing the requirement as it first starts, but then all the language is new. So are we doing more than reestablishing the requirement?
Lisa, you're shaking your head. You want to respond to that?
So the original bill, the 2019 bill, had separate sections to it. Some of those did not sunset, but one set of provisions did. And that sunsetted on January 1st. So technically, it's no longer part of our code, and this bill is putting it back into code. Gotcha. Thank you.
Any other questions or comments? Can I have a motion on the bill from a committee member?
I move that we move forward with the bill.
So you're
second.
moving favorable, Delegate Woods?
That is correct. My apologies.
Second.
Thank you.
Second.
Okay, and I've got a couple of seconds, Delegate Bandari, Delegate Kaiser. Any further discussion on HB 279? Okay, seeing none. Those in favor of 279, please say aye. Remember to unmute yourself.
Aye.
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 Aye. Is there any anyone voting in opposition to the bill?
I vote nay.
Okay,
I
So I
vote
have-
nay.
Delegate Morgan,
Yeah, we normally raised our hands, if I remember correctly from last year.
and thank you for reminding me, Delegate Morgan and Delegate Kipke. I have Delegate Morgan, Delegate Schlega, Delegate Kipke. Anyone else? Okay. All right. The favorable motion passes. With that, is there any other business that you'd like to bring up in front of this subcommittee at the moment? Then seeing no hands, thank you all very much for your time and your attention to this, and we will move this bill to a voting session of the full committee. I suspect it'll be Friday, but that's something that will be discussed internally. All right, thank you all very much. Have a great afternoon.